All right, let's get started. 5, 4, 3, 2, 1. Doc, thank you very much for your time.
Yeah, thank you for having me here.
First question, and this is a question that comes straight from my heart and comes from a very good friend of mine. First question, right? I never ask a question right at the beginning, but here we go. How do we fix a broken heart?
Well, so I'm a cardiac surgeon. I could stitch it up, but in the literal, figurative meaning, I don't think I can help with that.
No, one of my friends was like, you have to ask him. That should be definitely your first question: how to fix a broken heart. But if people could figure that out, that majority of the problems in the world would have been solved, right?
Probably.
No, it's a pleasure to have you here, and we've been talking on and off. It's a pleasure to have you here, and thank you very much for coming. One of the first things that I straight up wanted to discuss was, this a few days ago, and it was such a tricky thing or non-tricky because I kind of follow a diet too. And recently I've been starting to follow a diet. I have my own goals, and I keep challenging my body, and I just always want to see what can be done. Dash भन्ने एउटा diet रहेछ के हैन dash भन्ने एउटा specific diet रहेछ अनि यसमा चाहिँ the salt levels like so low. And I was contemplating on maybe I was dwelling about it. म गरौँ कि नगरौँ यो diet भनेर. Later on, again, I read more about it, and I was like, हैन, you do need salt in your body. And that got me thinking, and I was reading so many different articles, and one of the things that hit me was the amount of salt that a person needs to take. If that can be worked on, obviously your heart is going to be in a better shape. I want to start off by asking you one of the most important questions is, how much salt do we need in our body?
First of all, thank you for having me here. I mean, I know we talked a lot. And wanted to do this, but it took some time. Now, I don't think I can give you an exact number because I'm not a dietitian, but the point that you raise is, especially in people who have high blood pressure, limiting your salt intake becomes important because that can increase your blood pressure. Now, with regards to the diet, I'm not sure about the DASH. I know I've heard of it, but I don't know the intricacies of it.
No worries.
I mean, there are a lot of diets that have come through, especially over the last 10 to 20 years.
Don't even ask.
Yeah, exactly. So I think with all these diets, I think what it implies on is lifestyle.
Oh.
I mean, eating a healthy, balanced diet, right?
Yeah.
So I think we're coming down to that. I know. So whether it's salt, whether you take adequate lean meat, you're not having too much of, the red meats, or you basically control the cholesterol in your blood. So that comes to a lot of lifestyle. So that's basically diet and how you live your lifestyle. So maybe lots of fruits and vegetables, decrease your carbs.
Yeah.
So it does change a bit because I know around maybe 10 years back, it was like a protein-rich diet, nothing else, no carbs.
Oh, exactly.
That was there for some time.
Yeah.
And then again, now it's changed slightly. Now intermittent fasting is becoming
a big thing.
Yeah. So I think it does change. But I think what all this emphasizes is one thing, is just a healthy eating habit. I think that's exactly what we imply by the entire thing.
Yeah. The thing that was hitting me for the past couple of days was salt for me personally. Because मैले चाहिँ एक-एकवटा कुराहरू पिक गर्दै गइरहेको थिएँ and I was just wondering how much salt intake should I take. Now obviously not everybody is going to do that. There is a very small amount of people who are going to actually think of like what they are taking हुन्छ नि हैन त्यो पनि कति अमाउन्टमा हैन अनि I've associated myself with X amount of people who specifically pick things के हुन्छ नि हैन कति चाहिँ खाने कसरी मिलाउने भनेर हैन. Times have changed. I didn't care about my health at one point of my life, and then obviously as you grow older you start caring about your life as well, and as you grow older you start focusing and working on so many different aspects of your life. And I definitely want to say this right away that thank you, because when my mom was unwell I was talking to you as well, and thank you very much for that as well.
Sure, my pleasure.
Majority नेपालीहरूको एउटा समस्या चाहिँ के रहेछ भन्दाखेरि चाहिँ मैले थाहा पाएको चाहिँ after my mom got slightly unwell was cholesterol is like such a big deal. होइन अनि मलाई त थाहा थिएन त्यो आफूलाई नपरिन्जेलसम्म त्यो आइडिया नै हुँदैन रहेछ होइन वाट आर द थिङ्स द्याट यु हेभ टु फेस अन अ डेली बेसिस वेन युआर वर्किङ नेपालमा स्पेसिफिकली
So I think there's two parts to what you're talking about. So I'm a heart surgeon, okay? So professionally, I come with patients. Professionally, I look most of the patients are at when they've already had the disease.
It had already happened, yeah.
Right. So the spectrum I see are the patients that are in, to some degree, let's say, I won't say trouble, need some help surgically.
Yeah.
So that's the group I'd see.
Yeah.
Now, coming down to the basic part with what you're talking about, cholesterol is very important.
Yeah.
And then the salt and the high blood pressure is very important. I think what you raise is a very important point, is that the awareness in Nepal has improved tremendously compared to maybe 20 years down the line. And if you look at the statistics also, it's actually getting better because our life expectancy has grown. It was 60s, now it's 71 for females and almost 69, 70 for males. So that means, and what is important with this disease, the cardiovascular disease, this is the number one killer in Nepal also. Almost 17% of deaths. Almost 18.6 million deaths a year is because of cardiovascular disease. And what we know medically is that South Asia is one of the, is going to be, is, you know, like the Western countries are getting it down, we are going up. Okay? So what we say statistically is cardiovascular death, that's due to heart attack, stroke, all these things. Among patients who die who are less than 70 years age, 1 in 3 is actually a premature death, meaning you could do something about it.
Yeah.
Okay? And this is even higher in low middle income countries, which we are.
We are right.
Exactly.
There, yeah.
So we are right in the, it's what I would say is a cardiovascular epidemic. And that's why there's a lot of things how to tackle it. Now coming to the basic part of it, so like you said, so there's very components, there are a lot of components of heart disease, but sticking to, I think what you are working on is the hridayaghat bhन्छ नि, heart attack and coronary disease भन्छ हामीहरू भनेको मुटुलाई सप्लाई गर्ने रगत नलीको disease. So those are high blood pressure, diabetes, cholesterol, and then there are some genetical factors. So you could have age. So as you grow older, you have it. So that's something you cannot change. Gender. If I'm a male, I have a higher chance. But after menopause, females will have and then genetic disorders. So these are things that you cannot change. But what you can change is your blood pressure, your diabetes, your cholesterol, your lifestyle, exercising. Now coming back to what you talked about, the high blood pressure part. It's basically awareness among people who are more than 40 years or 50 years old. Almost 40% have high blood pressure in Nepal. This is Nepal statistics.
40%.
Yes. So there was a study done some time back where they looked at prevalence in the sense the presence of high blood pressure, awareness about it, whether you're seeking treatment, and actually you're having a proper treatment. So 4 components. So that's improved compared to previous years. So that's a very interesting thing. So it's improved compared to previous years, but
the problem is still there.
Yeah. So and I think that's the more important thing is I think like these things that we discuss, and it goes out to the audience. At least it brings awareness.
Yeah. It hit me. कस्तो हुँदो रहेछ भने obviously a person like me, I barely understand anything. Forget about medicine. And when it happens to your family, in your house, आफ्नो घरमा भइसकेपछि मात्र त्यो थाहा हुन्छ भनेर भन्छ नि हैन त्यतिखेर चाहिँ त्यसपछि it hits you. You're like, oh my God, you don't realize it. I'll share this story with you where people that I know within my spectrum, चिनी खायो भने सुगर हुन्छ, चिनी खाएन भने सुगर हुँदैन हैन त्यस्तो त हुँदै हैन diabetes is something that can happen. It's probably not really sugar at all, but that's the misconception that we have as well. So those are minor things that we have here. Another thing that I was talking to you off the air and said, let's get started with right here, and obviously I'll move to surgeon, I'll move to many different things. I didn't know. मलाई थाहा थिएन that there is a difference between heart attack, stroke, cardiac arrest. There's difference between all of these things, right? Recently, when I was just studying about a few things, I was like, oh my God, these are all completely different things, right? Would you mind elaborating a little bit about what people go through when it comes to heart problems?
So, just for general information and knowledge, so what I would say is heart disease, there's a big spectrum of this disease. Do I need to speak in English or Nepali?
Bilingual would be best.
Okay. त्यसै कारण हामीहरू चाहिँ congenital भन्छौँ कि जन्मजात congenital. So जन्मजात रोग. So when you are born, you have some form of heart disease. So that is actually 1 in 100 live births. So out of 100 people who are born, one will have some form of, it could be a minor, it could be major. And that itself is a big...
What? Are you hearing this? Okay, 1 in 100 will have live something births. Or the other.
Yeah, so it can be just like small hole in the heart to, like major valve problem or basically heart ko banawatmai variation. And most of this is treated surgically, okay? So that's where we come in.
Yeah, obviously.
And now they are specified congenital surgeons, so congenital heart surgeons, so it's a subspecialty. So that is one. You have a lot of those patients, one. Then the second is what we say is valve, mutuko valve bhaन्छौँ नि. Valve को समस्या भएको हो, valvular heart disease हरु. अब त्यो चाहिँ नेपालमा कस्तो छ भने rheumatic बातजोर भन्छ नि. So that prevalence is very high. So the Western countries, more developed countries, that incidence is going down. South Asia, that is still the predominant valvular heart disease. बातजोर भनेको चाहिँ त्यो घाँटीमा संक्रमण हुन्छ when you are a school kid, not treated properly. Then the body's reaction causes antibodies to form that affects the heart.
Okay.
And that can affect the valves.
So घाँटीमा चाहिँ के problem हुने? Thyroid?
होइन, infection.
Okay. So infection, tonsil infection, this infection, that infection.
Yeah, so that's what part. So whenever you have a throat infection, then you need to go see a physician because it can have implication. Not minor ones. There's a specific, it does, we shouldn't get everyone crazy about it, but it's a specific form of infection. But if it is persisting, then you need to, get it checked. So that prevalence is almost 1, in some, it's up to even 10, 1 to 2, we would say, per 1,000. Okay. School kids, 5 to 15. Okay. So that's the second group. And then that same valve disease you can have as you grow old. It's we call it degenerative. त्यो खिँदै जाने जस्तै मुटुको भ्याल्भ पनि खिँदै जान्छ
बुढो हुँदै गइसकेपछि
so sometimes you need to do a surgical procedure to either replace it. So you replace it with either you can repair it, मर्मत गर्नु पर्यो कि replace गर्नु पर्यो. Okay. So I won't go in details with that. Then is the one that we talked a little about is the coronary artery disease. So it's when your हृदयघात मुटुको which is very more commonly talked because it happens in the middle age group हैन. त्यसमा चाहिँ it's basically अघिको तीनटा जुन कुरा भने मैले genetical, age, gender, and त्यसपछि all this high blood pressure, diabetes, all these risk factors, cholesterol, lifestyle, air pollution, all these things. So these come in.
Yeah.
Then you come to the fourth one would be there is aortic disease on मुटुबाट निस्कने मूल रगत नाली. So we are like plumbers.
Yeah.
So the plumbing system of your heart and blood vessels gets affected. It can get swollen, sometimes can tear. So you need to do that. So those are aortic diseases.
Yeah.
Okay. Then there is something that covers the heart. It's a membrane. You can have disease of that. Okay. And then you can even have, believe me or not, you can have tumors of the heart also.
There's a tumor within the heart.
Yes. Of the heart, different parts of the heart.
Small little tumors.
Yeah, so just putting it broadly across, it's a big spectrum. So what most of us, there is awareness, but we emphasize more on the hृदयघात part.
Heart attack. Heart attack Englishमा त्यसलाई भन्दाखेरि heart attack part. Obvious छ नि त्यो सुन्छौँ पनि हैन हामीले we see it on cinema, we see it on so many different things. हामीले त्यो सुन्दा बानी भइसक्यो okay. नेपालमा कुन surgery चाहिँ do you have to do the most?
So
what is our major problem?
So right now if you look at the recent statistics of the whole country. We've worked on it, and we've 2019 because we got all the data of the entire country. So the most surgeries we do is valve in Nepal as heart surgeons.
Yeah.
So that's the most. Then after that is congenital, and then is this coronary. So the coronary numbers are growing up because again coronary हामीहरु जुन त्यो angioplasty spring हाल्दिन्छ, stent हाल्छ. So that त्यो चाहिँ cardiologist चाहिँ गर्नुहुन्छ. So when it becomes more severe or there's a critical area blockage, then only it comes to us. So that disease is divided between cardiologists and us. So that is also going up. That's why I mentioned the burden of this disease is climbing up, especially in South Asia. But it's not
the end of the world.
It's not doom or gloom. It just all it asks is just be aware of it.
Yeah. Constantly on this podcast, from the day we started this podcast, constantly I've been talking about health, because when I started this podcast I was in a kasto samayma thiye bhane ma chahi I'd just taken a break from smoking cigarettes. ठ्याक्क त्यो हुन्छ नि त्यो एउटा त्यो ठ्याक्क त्यो फेजमा थिएँ अनि we talked about health and we talked about हुन्छ नि anti-smoking for a long time in the beginning phases of this podcast. I believe in 2020 हुन्छ नि हामीले धेरै कुरा गर्यो हैन अनि obviously once you start reading about it you're like okay हुन्छ नि now your heart must be better now हैन 2-4 वर्ष चुरोट खान छोडिसकेपछि त अलिकति बेटरै होला नि भनेर सोचिँदै रहेछ हैन अनि then we constantly started talking about health, but I didn't know that 1 in 100 might have a heart problem. I didn't know that at all.
You mean the congenital part?
Yeah.
Janmajatko huncha. So there's a big spectrum.
Yeah.
So I think it's important, and I think this is a great forum that you took this up because it brings awareness. Basically, what we are trying to do is make people aware.
I'll ask you this straight up: smoke when you're doing surgery, and if there's a smoker, will you know that this person is a smoker?
So I screen them before.
Yeah.
I mean, the lungs can be bad. So basically, I think to make it maybe answer it more easily for you.
In layman's term,
in Nepal, when you see the lungs, you can look and say that, okay, this is a pristine lung as opposed to a more exposed. In Nepal, there is that few things there's air pollution. And then our air pollution are two. So you may be a smoker and that's why you've had it. But in the villages, there are people who use the chulo use garsanta. So that's another big factor. So, but yes, coming back to it, if you look at the lungs and you can make out like, okay, this person maybe has a little bit more of a worry something as compared to someone whose lung is more pristine.
I want to stick with the smoking factor right now. Majority of the people smoke in our country. In a sense, young people, they do smoke. Okay. I think. I don't have the data. We don't have the data. But again, majority of the young people at least have tried smoking. How big of a deal is it actually? Of course, you smoke, you're screwed. When it comes to hearts, how much does it affect your heart?
Definitely. It's one of the major, like high blood pressure, diabetes, cholesterol, smoking, alcohol. Lifestyle.
Oh, okay.
So that's one already there.
Smoke is already
there. And then the longer duration you smoke, the more you smoke, all these things come into play.
Wow. Secretly, like if you had to describe it, how does it directly affect your heart?
So it has the nicotine ko bhayo हैन त्यसकोले चाहिँ कस्तो भने you're basically one is because you're smoking the dust or whatever the particles, your lungs is affected, हैन. So you can have lung diseases, which the heart and the lung is very closely related in how they function. And then second thing is the arteries जुन blood vessels नि harden हुन थाल्छ कि. So even your mutuko blood vessels can harden. And then they'll cause blockages.
We've heard about it.
Or even like खुट्टाहरुको कतिजनाको if I don't know whether you they walk and they have leg pain, खुट्टा दुख्छ हिँड्नै सक्दिन हैन. त्यो कहिलेकाहीँ त्यो big smokersहरुकोमा चाहिँ त्यो खुट्टाको blood vesselsहरु पनि त्यो block हुँदै जान्छ कि. So then you cannot function नि.
खुट्टाको blood vessels because of smoking.
So the principle is the same. So what you mentioned a little bit about stroke is the same risk factors. So these are all related. Wow.
I know, that's very, very interesting. All right, let's break it down slightly some more to everybody. Stroke भन्नुको मतलब चाहिँ के हो डक?
Stroke भनेको like जस्तै heart attack जस्तै it's like a brain attack. हामीहरू पक्षघात भन्छौँ नि, paralysis. So in a severe form, you can, like a mild form, you can maybe have lose your consciousness, or like feel a little lightheaded, or you can have like a stroke would be like you can have like paralyzed, and so you're not able to, or you can't move your hands, you lose your speech. So it's basically a brain stroke.
Yeah.
Brain attack, like a heart attack, it's a brain attack, but the principles is the same. For a heart attack, what we worry about for the brain also is more or less the same things. Cardiovascular disease ma brain ko hune ra mutu ko hune more or less risk factors are same hai sa hai.
Wow. डेङ्गु लागेको थियो कि मलाई हैन, अनि कस्तो इन्ट्रेस्टिङ कुरा के थियो भन्दाखेरि चाहिँ I did have a slight conversation with Dr. Ishan about this. I wear a watch which gives you your heart rhythm. And dengue लाग्दाखेरि चाहिँ अचम्मको कुरा के भएको थियो भन्दाखेरि चाहिँ my heart rate post dengue हैन लागेर त्यो ठिक भइसकेपछि 15 दिन 20 दिनपछि म उठेर I went back on what I was doing हैन. My heart rate was so down. हैन त्यो के भन्छ रेस्टिङ मात्र पनि हैन कि यतिकै पनि इन जनरल हार्ट रेट यस्तो तल गएको थियो कि फर लाइक अलमोस्ट लाइक 15-20 days, एन्ड आई डिडन्ट नो व्हाट वाज गोइङ अन. अभियसली हामी सबैजनाको डक्टर भनेको एउटा हो हजुर, त्यो भने गुगल हो हैन, जुन वी शुडन्ट बी डुइङ.
That's the biggest doctor.
That's the biggest doctor. अनि I stopped googling after that हैन. अनि it said something about electric I completely forgot the term, but it was some kind of the heart rhythm goes up and down when you get dengue or something like that. But I never cared about it, so I'm sure it got back to normal. Can you elaborate a little bit on this?
So I think with yours, I think we had a conversation some time back. So people who are athletes and who exercise, their heart rate becomes much slower. It's basically the body's like mechanism of is when you do a lot of physical activity. You'll have like athletes with 40 to 50 heart rates. They're perfectly fine. Now, this is a good thing. It helps detect your watch. But like I get a lot of patients who go, Doctor Sahab, mero ta heart rate 40 bho, atha mero 120 bho, and then you're more anxious, and then it goes to about the 140 bho, what should I do? So there's a like it brings about a caution. So it goes down. If it's alarmingly low, yes, I think what I would advise is the platform it's best to seek medical advice.
Yeah.
Go see a physician, just make sure everything is fine. And then, then you can go about doing your normal thing. Because what we worry is we don't want something, like drastic to happen and then seek for help. English prevention is better than cure. So just go and once see the person, and then he'll just assess and everything is fine, and then you're good to go.
Yeah, I'll tell everybody not to Google things. Google गर्यो भने चाहिँ एउटै कुरामा गएर ठोकिने रहेछ, त्यो भनेको क्यान्सरमा गएर ठोकिने रहेछ. Even if you have ज्वरो आयो भने पनि गुगल गर्नु थाल्यो भने क्यान्सरमा गएर ठोकिने रहेछ.
I'm sure a lot of doctors also Google, so it's okay. Honestly, I also Google sometimes, so it's okay. It's a very informative tool.
Yeah, it definitely is. So, what is like a heart rhythm भनेको चाहिँ के हो खास, if you had to explain it to everybody?
मुटुको चाल भनेको चाहिँ कस्तो भने is a fascinating organ. Okay, so it's got like 2 upper chambers and lower chambers. So normally, I don't know, when the heart moves, it's like माथिको chamber गर्छ, you relax गर्छ, and then this moves. It has a circuit like how you switch it on, and then the electric current goes, and then the lights come on. Yeah. So heart has a system. Okay, so it starts from here, and that generates your impulse and goes down, and then the heart contracts. Okay, so there's a lot of things that can happen in between. So can maybe go out faster, or go slower, or the coordination between these two may go bad. It's like an electrical circuit, let's put it simply.
Sure.
So circuit
then you come to play.
Yeah.
If you had to describe it to everybody, like what is like a perfect rhythm? What is like a perfect heart rhythm?
अब हामीले भन्दाखेरि चाहिँ साइनस भन्छौँ हैन साइनस rhythm भन्छौँ तर rate is around 60 to 100. So by definition, if it's less than 60, it's low heart rate, and more than 100 is fast heart rate. Having said that, like when you're anxious, when you exercise, when you maybe do some physical activity, you're angry, त्यसमा चाहिँ heart rate बढ्न सक्छ. So resting heart rate is around 60 to 100.
But
like, athletes don't call me tomorrow because it can be a little bit lower.
Yeah. No, the thing is, a lot of friends, especially with social media now, with आज एकजनाले लेखेको मैले पढिरहेको थिएँ हैन, काश सोशल मिडिया पनि 6 बजेपछि बन्द भइदियो हुन्थ्यो भनेर के हुन्छ नि. After 6 o'clock, the social media is 24/7. You're on Instagram, Facebook, YouTube, watching this 24/7. If it was off, you'd do other things, but it's not off like work, So obviously, the attention span of people has decreased. मान्छेको attention span त 3 सेकेन्ड कति छ एक्स हेरेर त 3 सेकेन्ड 2-3 सेकेन्ड कति छ के अरे. So obviously, we're always in a state of के भने त्यसलाई rush भन्ने कि के भने त्यसलाई, I don't even know how to describe it. And I'm sure our heart is constantly working way more than before, I'm sure. Like 30 वर्ष 40 वर्ष अगाडिको कोही व्यक्तिलाई हेर्ने हो भने र हामीले हेर्ने हो भने maybe we are starting to have other things that we see in our heart.
True, but again, I think our fathers and grandfathers had more physical work. So that way also. So I think the important thing is you need to find some time to do exercise.
Yeah.
I think that's what's important. I think the now generation understands that more probably. I think because you can see a lot of gyms coming up, people actually do work out, but it has to go more into the population. So what we say is 150 minutes a week. So what I tell my patients is either you can do 30 minutes 5 days, you want to take a break, or you can do 20 minutes every day. But like good physical exercise. And then if you're doing strenuous exercise, then we say 75 minutes a week.
In total?
Yeah. So at least if you break it, it's basically just a little bit of discipline.
Oh.
I think that's what it is. I mean, it's there in every profession.
Yeah.
I mean, every profession requires you to be a little bit disciplined.
Yeah.
So why not with your body as well?
I completely agree with this. And now let me ask you, what made you come in this profession? Like what shaped you to be who you are today? What is the main factors?
Birth asphyxia. That's like, no, I'm just kidding.
Look at my eyes. Look at my eyes right here.
So basically, I mean, I was pretty good at studies, and then I was drawn to science, and then went into biology, and then I thought, I think this is what I want to do. So I got into medicine, and then as you learn in medicine, I was fascinated about the heart. And that's how gradually, by small processes, I started going into this. And then finally, I worked in general surgery for some time, and I said, wow, I want to do surgery. And then heart and surgery. So this is how I got into this field.
Well, you're one of the best that we have in this country and in the world. So thank you very much for your time here.
Much.
Now, there's one big thing that everybody kind of definitely wants me to talk about this. Open heart surgery bhane चाहिँ के हो doctor?
So open heart surgery bhaneko चाहिँ is basically, this is heart surgery is very fascinating. Okay, so it's not very old. It's compared to other surgeries. It started maybe in 1950s only. Okay,
in the world.
Yeah.
Okay.
So the modern heart surgery. So before, actually, the surgeons itself would say anyone who touches the heart should be kicked out of the profession because it was 100% mortality. So anyone attempted to do any form of surgery in the heart means this guy is not a good guy.
Yeah.
He doesn't have he doesn't have discipline, and he should be removed from the profession. So when it started off, it's amazing. This is the only surgery where you had 200% risk initially when it started off.
In the 50s.
Yeah. So 200% risk is, so when we do surgery, you need there's a machine. It's called a heart-lung machine.
Okay.
So the machine works as a heart. It pumps. And then there's a lung component which provides oxygen. So through pipes, so it's open heart is like you open the chest. The heart is here on your left side. And then through tubes, we take the blue blood, that is the used blood, which doesn't have oxygen, goes into this machine. And then the machine provides the heart function. And the lung component provides the oxygen. And then through a pipe, you take it back into the main blood vessel. And it circulates to the entire body, okay?
Okay. This is the machine?
Oh, yeah, exactly.
That's
great.
the machine.
You guys are great, yeah. So that's the heart-lung machine.
Okay.
Okay? And then what we do is we give a special solution to the heart to stop it for some time,
Mm-hmm.
okay? And then we do the surgery, and after we finish the surgery, we revive it. Now, coming back to your 200%, so if, let's say, something goes wrong, it should be 100%.
Yeah.
So initially, before this machine was developed, they would have the father or the mother act as the heart-lung machine.
Oh. Paila.
That's how it started off. That's how innovation. So you'd have, let's say, if a child is undergoing surgery, the mother or father would be beside. So if something went wrong, you're actually looking at two deaths. Yeah. So that's how, it's amazing how this field is developed. And now, present time, if we do it in Nepal as well, so our temperature is 37 degrees. So we cool the body to 20 degrees through the machine.
Huh.
It's a very controlled decrease to 20 degrees. And we stop the circulation and do surgery also. So there's no blood flow. The heart is not working. There's no blood flow to the brain. The brain is...
It's frozen.
Yes.
Okay.
But you have a time frame, so it's like around 30 to 40 minutes. You finish the procedure, and then again through the machine, and then you gradually bring the temperature back up.
Hold on, this is okay. This is too much information for me. Hold on. This is too much information for me. Okay, hold on.
So science. This is
science.
Yeah.
Okay, I had no idea that you can freeze a human being right now and then
freeze in the sense. So 20 degrees is not frozen.
Okay, yeah.
So you wouldn't go below 18.
Okay.
So I think you might have heard stories, like where someone, especially in America, winter we don't get too much of the Himalayas climbing. We had one person from Malaysia, actually a climber. He was lost for 2 days, and then when he came in, he was hypothermic. But if you look at you'll get stories in Europe and US, like someone got lost and he was hypothermic, and then they brought him back, and then they warmed him, and then
he was back.
Yeah.
He or she was back.
Yeah. Some of them, they may have some defect or whatever, but then was back. So it's basically these things. So like science does amazing things.
That's why it's called a practice, I know. One of my friends was trying to explain this to me.
True.
One of my doctor friends was trying to explain this to me. That's why it's called a practice. Hold on. So Nepal ma ke available cha ta when it comes to surgery? Everything.
So we do everything except two things. So one is heart transplant चाहिँ भएको छैन नेपालमा
अहिलेसम्म भएको
छैन किनभने हाम्रो लले नै सुरुमा अलाउ गराएको थियो. नाउ इट्स इज्ड अप बट देयर स्टिल अ लिटल बिट अफ प्रोसेस. किनभने हाम्रोमा चाहिँ त्यो कस्तो हुन्छ भने हार्ट ट्रान्सप्लान्ट गर्दाखेरि चाहिँ ब्रेन डेथ मोस्टली भनेको द ब्रेन इज गन बट द अदर अर्गन्स आर फङ्सनिङ. यु टेक द्याट हार्ट स्पेसली यो रोड ट्राफिक एक्सिडेन्ट त्यस्तोहरूमा. सो यु देन टेक इट आउट एन्ड देन यु पुट इट अन अ पर्सन विथ अ डिजिज हार्ट. हाम्रो चाहिँ ब्रेन डेथको डेफिनेसन यिनीहरूको लिग्यालिटी मिलेको थिएन. आई थिङ्क नाउ इट्स मच मोर क्लियर. सो पोटेन्सियल देयर इज अप्सन. एन्ड देन दि अदर थिङ इज वाट आई से इज यो आर्टिफिसियल हार्ट, मुटुलाई सपोर्ट गर्ने डिभाइस, भेन्ट्रिकुलर असिस्ट डिभाइस भन्छ. यिनीहरू चाहिँ actually you could do it. They've started doing it in India. It's very expensive.
What is it called again?
Ventricular assist device or total artificial heart. I think
try to find it.
VAD garyo भने पनि आउँछ होला. Okay. So these things, it's very expensive. It's almost 60-70 lakhs. So, like having this available, I think that's another thing that we could talk about. That's the thing. Because unfortunately or fortunately, yeah, so that's a ventricular assist device. So you can see that's the heart, and can you see that titala cap just ni? So when your heart is weak, so it doesn't function, right?
Yeah.
So through that cap, it sucks the blood, goes through the pipe and it goes to what is called the aorta. That's a mool ragat nali.
Okay.
So actually the heart's function is to push blood into that aorta.
Okay.
But now the device is doing it.
It's a device is काम गरेछ
त्यसबाट त्यो blood suck गरेर त्यो सेतो पाइप छ नि tube carrying blood to aorta त्यसबाट अनि रगतमा पठाउँछ.
What are the other things? Batteries and things like that?
Yeah, so it requires a battery and a controller and all that stuff.
So how long will a person survive like this?
Oh, people have survived. I mean, there are complications associated with it, but people have survived. I mean, when I was at US, the company guy had a guy who had become a model patient. So he'd go and talk because, people are skeptic about.
Obviously.
Yeah. Oh. So he had survived more than 7-8 years on it.
On the machine?
Yeah. And then, it's if you look at it, it's actually like kamis लगाएपछि त थाहा
नै पाउँदैन. And the pipe त्यो तार चाहिँ कहाँबाट जान्छ त?
So this part goes inside your body.
Yeah.
There's that wire. If you look at it, there's a wire that comes out.
Yeah.
Which goes into your battery pack. And then you change the battery pack
from time to time.
Yeah.
Yeah.
So can you see that wire, that drive line?
Yeah.
So that. And you can see that small hole.
Oh,
so
that's
the only thing that comes out. So, and then you wearing something like a small backpack.
You wouldn't know. Nobody would know.
No, nobody will know.
And the machine's actually making you live.
Yeah.
If the battery goes, you're gone.
But there are ways that you work about it.
Oh, okay.
So this we haven't done.
You कति वर्ष अगाडि गयो? You कति वर्ष अगाडि आएको थियो होला?
Worldma, I don't know exactly, but I think it should have been there, maybe some degree of it. Actually, one of the guys I trained under, so
in the US.
Yeah, so he was involved in the total artificial heart. He was one of the pioneers. So they did it in 1960s, but it was a more crude form. So things get refined.
Obviously.
So, it's bigger.
Yeah.
And then slowly, technology makes it smaller, more compatible. So this is the new one. Okay.
Interesting. यही कन्भर्सेसन गरेमा पेसमेकर भनेको के हो खास?
पेसमेकर भनेको चाहिँ मुटुको चालको लागि हो. त्यो चाहिँ it's like a small thing that you put here, and then it goes into your heart and it helps your मुटुको चाललाई.
अघि नै हामीले कुरा
the
rhythm.
Yeah, exactly.
And that was developed a long time ago. Hamroma obviously
that pacemaker is there. So only thing is what this we can make available is the cost. Okay, like now there's no new therapies coming in. Like what we say is that TAVR, percutaneous valve, operational kind of valve. To say usually you don't do it on all, but high risk patients. Let's say, like I said, valve को समस्या कहिले काहीँ वृद्ध हुँदै गएपछि हुन सक्छ भने नि त्यो डिजाइन त्यस्तोमा चाहिँ अब let's say you get a 85 or even a 90-year-old person, otherwise fit, but as a valve को समस्या and the open surgery becomes very high risk. So then these are the things, but these are expensive things. So now we've started it. They've done like around 7-8 now, but these are the things that and they're expensive. One valve costs 20-25 lakhs.
Yeah. Ooh.
Yeah.
Ooh.
That device is 60 lakhs.
Ooh. That's a lot of money.
Yeah.
I want to say this on record. You can take my heart any day if I die. Right? Take it, do it, do whatever you want. Save somebody's life. Right? Nepalma open heart surgery गर्न नमिलेपछि मान्छेहरू कता जान्छन् त?
होइन, गर्न नमिल्ने कुरै छैन. So I think this is a good forum. I think this is a good thing that we talk about. So in Nepal, I mean, we were much later than even our neighboring countries. So I think the first any heart surgery was done actually in 1967.
The first one?
Yeah, by a doctor called Dr. Gongol. He's now almost 90 now. He's still alive. And it's amazing that what these guys have done.
Where is he from?
Kathmanduकै हुनुहुन्छ.
In Nepalको कुरा गर्नुभयो? Okay.
So in I think the first open heart was around 1953.
Nepalma?
No, in US.
In US. Okay.
Here, some form of heart surgery, first one was documented is around 1967.
1967?
Exactly.
Wow.
The first open heart surgery was around, I think, 1989, if I'm correct. And then the all Nepalese team was 1993.
Okay.
So in the last 2 to 3 decades, we progressed a lot. Okay. Like Gangalal now, they do almost 2,000 cases a year. 2,000 open heart surgeries, almost open heart surgeries a year.
Okay.
Manmohan does, and now there are almost 16 centers in Nepal that does open heart surgery. I think where you're coming at is there's a little bit of lack of confidence in doing it in Nepal. Otherwise, except for this and the transplant.
Oh, transplant was the thing that we don't do. Okay.
Yeah. So except this we can do also.
Okay.
Except that everything is done here.
Huh.
But there's a distrust, right? Honestly. Because it started a little bit lower. Later.
Yeah.
So there's a little bit of distrust. So it's not only for heart surgery, actually. It's for a lot of things, right? Yeah, there's still
there's distrust for almost everything.
Yeah.
Once the Netaji stop going to Bidesh, automatically the trust is going to be there with majority of the other people too. But anyways, we can talk about that in a while.
I know. Yeah.
So the thing that we don't do is replacing
heart transplant. गरेको छैन यो एउटा गरेको छैन न त others everything else we do. Like that circulatory arrest, circulation band garega. We do. I have done almost 40 of these in Nepal.
एक हेरेर त मलाई कस्तो यो इन्ट्रिगिङ लाग्यो मलाई इन्डियामा चाहिँ कहिलेबाट स्टार्ट गरेर रहेछ एकपल्ट हेरेर त एउटा स्पेसिफिक डेट निकालेर त देन वी क्यान युजुअली लाइक गो एन्ड ट्याली इट आउट
आई थिंक इट मस्ट बी 1960s ट्रान्सप्लान्ट इन्डियामा गरेछ
ट्रान्सप्लान्ट इन्डियामा चाहिँ गर्छ कति के भनेको एक्स कति भने 19 कति भने ट्रान्सप्लान्ट भनेको मैले हाम्रोमा चाहिँ के कुराले हाम्रोमा पनि त अब आई एम श्योर वी हेभ टु स्टार्ट द्याट सुनर अर लेटर if I'm not mistaken.
So all this will have to come together, So like we've got ECMO now. We run a good ECMO. ECMO is like that artificial heart, but it's like it's a temporary one. This is more of a semi-permanent. I mean, it's a year after Harry Costa Bonsavani. It's like a bridge. So it's a bridge to transplant, bridge to cure, or a destination. So destination means you keep it on, okay? So you can use this as a temporary mechanism to go in for a transplant.
Yeah.
Or sometimes the heart may be weak because, like just temporarily. So you put something like this, and then once the heart recovers, you can take it out.
Yeah. Yeah, you can use it for a while.
And now for a shorter term, there's a thing called ECMO. I don't know, ECMO.
I had written it down.
Yeah.
I can't even membrane oxygenate or something like that. I can't
even. 1968.
यो भारतको हो यो बम्बे सर्जनले बम्बेमा चाहिँ 1968 मा चाहिँ दिस वाज द what is this again open of heart transplant, right? So they've been doing that since 1968.
I think they've become a little bit more organized now compared to, so they did it initially and then there was a little bit of a lull and I think now it's again picked up a little bit.
Yeah.
But like these things, there's always a rush to be the first to do it. I mean, I think it's more important that you set up a program that's long-lasting than, but there's always this rush of, I did the first, I did the...
No.
So I think these things will come in, but then we can facilitate it,
Before we move on towards ECMO, मैले सोधिहाल्छु हजुरलाई त्यो मैले सिनेमामा देखेको यो होइन त्यो एउटा त्यो वेटिङ लाइन के हुन्छ नि होइन somebody's heart has issues and that person wants a transplant होइन अनि त्यो वेटिङ लाइन हुन्छ नि होइन do we have a waiting line in Nepal?
No. Not for so this is कस्तो भने
you're getting me where I'm getting it. Okay.
So this is heart failure surgery भनेको मुटु काम गरिरहेको छैन it's you need to support it for a long term somehow or the other. So that is the part which we are still, partly because of the financial aspect of it, because that becomes expensive. Even transplant, the surgery is not very complex. I did maybe 5 when I was in US, including the procurement part. So it's interesting in the sense like it's fascinating even for us as a heart surgeon because what happens is like, so there's a list like you mentioned. So transplant list pancha एउटा हुन्छ सो यो
डेटाबेस छ एउटा
भनेको सर्टेन रिजन्सहरूको हुन्छ एन्ड देन कस्तो भने ट्रान्सप्लान्ट भनेको चाहिँ युजली 6 to 8 आवर्स भित्र गर्नुपर्छ प्रेफरेबली shorter the better होइन अब अहिले there are new devices that allows you to keep it on for longer तर त्यो भएपछि कस्तो हुन्छ भने so when something happens there's a big database that tells you there's a heart available at this place and then the program director says okay maybe we should look into this so actually a team from the hospital goes. You go, and it's amazing because, like you don't need anything. You can go to, like, I go to Canada from US. There's a private plane. You go on it, then you procure the heart, then there's a police escort that, because time is important, escorts you, right? You get on the plane, come in, again on the ambulance, or then you go into the hospital and then you do it. So the surgical part is the glamorous part, that there's a lot of ground base that needs to be worked on.
Obviously.
But Nepal, we don't have that list right now. So I think this is the component where this heart failure component, these devices, you say ल्याउनु चाहिँ पर्छ. There are issues. I think we know some of them, what are the issues. I mean, we can talk about it a little later about it. But these things needs to come in. I mean, living in this century, we cannot be so behind in medical services. The first one in the US was done in 1960. It was a big contraption, but it was done in 1960s.
Exactly. We're in the
or
2000s.
maybe 70s.
Yeah. This is so... अस्ति मलाई एकजना मेरो एकदम नजिकैको व्यक्तिले भनेपछि it struck me slightly. We started this podcast with zero. We started this podcast with zero viewership, like no platform, no nothing. And now I believe just in one of our platforms we have almost 300,000 subscribers. Okay? I never cared about it.
Congratulations.
Thank you so
much.
That's
a good number.
Never cared about it. And somebody very close to me said, okay, that is 1% of the population of Nepal.
Yeah.
And I was like, oh, okay. Well, that is when you think about it that way, there's a ठुलो number. So same conversation, man. 3 crore जनसंख्यामा, now when you said that 1 out of 100 might have some kind of heart issues, minor, least to maybe major. So I'm sure you पनि त समस्या त छ होला नि त 3 करोड जनसंख्यामा हुन्छ नि हैन कतै न कतैबाट तर हामीले चाहिँ त्यो प्रोवाइड गर्न सकिरहेका छैनौं.
ट्रु. अब यसमा पनि कस्तो छ भने नि मैले भने नि अब सो कार्डियोलोजीको लागि अलमोस्ट देयर इज मोर देन 25 क्याथ ल्याब्स भनेको त्यो एन्जियोप्लास्टी गर्ने ठाउँ पेसमेकर हाल्ने अलमोस्ट 25 भइसक्यो. इट्स गेटिङ बेटर. पूर्व इस्ट नेपालमा इट्स quite well established now. वीरगन्जमा आछ, चितवनमा छ, बुटवल भैरवामा छ, नेपालगञ्जमा सुरु भयो. Now beyond that is an issue for cardiology. Now धनगढीहरुमा अलिअलि सुरु हुन लाग्छ, but it's still in infancy. मुटु शल्यक्रिया surgery को लागि चाहिँ there are almost 16 centers capable of doing it, but
across Nepal.
Across Nepal, but it's
majority
13 of it is in here.
Yeah.
In the valley. So there's Dharan, no, I would say 12. Dharan, Biratnagar, Birganj, and Chitwan. So apart from this, like there's a big gap. Now, there are many levels of issues which may be a little bit beyond us also that needs to go into looking into all this. Yes. Cardiology is there is, I think the numbers are cardiologists are bardhaisa Nepalma, so there people are moving peripheries because what happens, everyone wants to stay in one place. It's human nature.
Of course.
Then as opportunities start opening up in other places, then people start moving out. Yeah. I think it's in every field.
Yeah.
So I think that's happening. Surgery ma cha adha pani bhako chaina, which we professionally and even people like you who have so many followers. I hope I increase your following.
I hope that one person's listening till now. I care about that one person who's still listening. How many surgeons do we have when it comes to?
So we probably have approximately around 25 cardiac heart surgeons.
Heart surgeons, 25, give or take.
Yeah.
And more on the way.
Yeah, there are more on the way, but I mean, we need to promote the field also. You need more people. In every field, you need more people. You need to, as you get more senior, I think you need to look into how do I create space for people who are going to come in?
Yeah.
How do I train them better?
Yeah. Of course. 25 for 3 crore. त्यसरी लिउँ.
Yeah.
25 जना 3 करोड को लागि.
25 जना 3 करोड को लागि त्यसमा काठमाडौँको पपुलेसन कति हो?
कति पुग्यो 17 लाख एक्स हेरे त काठमाडौँको
काठमाडौँ भ्याली भन्नु न.
काठमाडौँ भ्यालीको कति पुग्यो ललितपुर भक्तपुर गरेर त 17-18 लाख पुग्यो होला नि 20 लाख पुग्यो होला अहिले त तानतुन गरेर मी थ्रोइङ आउट नम्बर्स.
So almost 19, 20 are confined to the valley.
The valley, and then 5, let's say, are out of the valley at the moment. Oh, obviously, you know, what stresses you the most right now? But when it comes
that's a big.
When it comes to यो पनि भइदिएको भए हुन्छ नि हैन गर्न सकेको भए, what stresses you?
So the way I look at it is, I've worked in the system. I want to be a little bit more optimistic.
Sure.
I know. I worked at the best places. I trained at the best places in the world, actually. We are behind. We recognize that. But then sometimes there are system things that needs working, which may be slightly beyond you, or you need to, lobby a lot. But I think, it's much easier there. It's more of a struggle here. But at the end of the day, this is your country. There's more gratification here.
Obviously. Yeah. You're taking care of 3 crore people. That's what I exactly said. Isn't it? Now, be very honest. Tell me what stresses you out. I'm sure
stresses me out.
In a sense, I wish I had this. Or I wish the system was not the way it is. And maybe it could change and make the patient's life better.
No, I think it's at multiple levels. I think it's not only one. So now what's happened is, like for me personally, so I was at Gangalal National Arts Center. Oh. It's a fabulous place. I mean, it's still well recognized right now.
We're talking about Mali,
exactly. So I moved into Mediciti. My aim to move into Mediciti is I want patients to stop going. So what we need to understand about medicine, I think there's a little bit of I think people understand, but maybe medical service is medical care with hospitality. We have to understand this. I mean, me as a physician, we have to understand this. If you enter the hospital, primarily you are coming in for a medical treatment. That has to be of certain quality. That's fine. But then there's a hospitality sector to it also. I have to be able to give you importance. I think that's where we are losing out patients in the country. I don't think, I mean, the doctors in Nepal are fabulous. It's like people who are trained in the best places in the world. But so why would people go out? Now slowly the infrastructure wasn't there, but it's getting better and better. I mean, the last 20, 30 years, we made tremendous progress.
Yeah.
So I think these are the things we need to recognize. So I think, like, unfortunately for my generation is like we are I would call the scapegoats who has to establish that. So there is, there is frustration, but it's difficult to pinpoint. I mean, like, there's many levels, now we need to lobby government level for a lot of things. Getting these newer devices, newer medicines in the country. There's legal procurement issues. There's so many issues. But, I mean, we need to work on this because, like, one thing which I want to mention is, Birami Hospital when things don't go right, it's hospital and doctors. But there's a whole system involved, which we protect. So I think that system has to come into place. Like what I wanted to discuss a little bit is having something like an insurance system. We don't have it. 50% of Nepal is out of pocket. Imagine the burden for the people. I mean, that's 6 lakhs. I cannot afford. If my heart fails, where am I going to get 60, 80 lakhs to put a device in, and then I don't know however long it's going to go. It's going to go very expensive. And it's not only for me, it's for majority. And American Nepal ma kosta ani feri medical service ko cha duita important cha. Euta ta hamro 25% poverty line ko muni cha. You need to cater for that also.
Obviously.
And then as the economy grows better, I mean, we are least developed, now we become
developing.
Yeah. So, medical, even in US, it's very expensive. A lot of people can't afford it. I mean, it's so much in the public about things. But I think we need some form of insurance system in the country. I mean, you cannot pay. Let's say the newer device comes, that heart valves, 25 lakh. The numbers would go up. Imagine, there's so much of 30 million populations, honey, that there has to be some form of insurance system. Paying out of pocket is not going to solve the service. And then another thing is it has to be cashless. Insurance system cost paisa तिर्यो, उपचार गर्यो, and then you go and claim.
त्यो पैसा कहाँबाट ल्याउने पहिला तिर्नको लागि पैसा त हुँदैन मान्छे
अनि त्यो भयो भने पनि त claim गर्दा it's such a hassle. Like let's say this happened to someone who's very well off. I mean a friend of mine. So emergency, go to the hospital. Then you say, okay, like maybe needs emergency surgery. X amount deposit garnu. People don't keep that amount of cash at home. You go to ATM doesn't function. What do you do now?
Yeah.
So I think that we need to start developing these things. And all these newer things will come in. And as these things come in, it starts getting cheaper. Because at the end of the day, medical industry is the business. When someone develops a newer device which is going to be groundbreaking, he does it because that company does it to make, let's say, he's doing it for the goodwill also, but then he needs to make his income also.
Yeah.
So these things you need to get in. Otherwise, you start falling far behind. And then people will keep going out.
How does it feel when you see that XYZ चाहिँ विदेश गएर चाहिँ सर्जरी गरेछ अरे अथवा XYZ ले गरेछ अरे हैन XYZ सँग एक्सेस छ अरे हैन how does it make you feel maybe you does it make you feel like I could have done it right here like why did you have to go abroad does that happen
it does but then again at the same time कस्तो हुन्छ भने अब there's risk in heart surgery so you cannot push it too much also it's basically a confidence thing right so what I look at it as now is maybe this people like me are going to be the ones who are going to bring that confidence to the people here.
Yeah.
So it's much like what you said about the frustration, whatever. So it's a more of a struggle, but I hope people who come behind me are in a better position than we are. It's the same with every profession. Like for you also, I'm sure you look at it like whatever I'm doing now, the next generation needs to be in a better place than me.
Obviously, that's what I do. That's what I do, and that's what I talk about all the time. Wow. Age group को हिसाबले हुन्छ नि हैन heart problem हुने एउटा समय त हुन्छ होला नि त हैन in a sense obviously हुन्छ नि but I'm sure there is a time period after this certain age like you might start having some kind of problems हुन्छ नि हैन not with everybody but I'm sure is the age factor पनि त हुन्छ होला नि हैन
so अघि भने जस्तै हैन अब जन्मजात रोग and then जुन बात रोग that happens at a much younger age हैन तर what I would advise or maybe recommend is once you touch 40 हैन actually just go for a checkup okay and especially if you have like त्यो family मा history of sudden मृत्यु भएको कोही हुनुहुन्छ परिवारमा first generation हरूमा हैन अथवा family history of heart disease as a father or mother has or even an uncle, aunt, brother, sister. So just go for a checkup. At least everything cannot be detected immediately, but at least there is a chance of screening. You might have high blood pressure. You're bringing down the risk factor. You might have diabetes, like what you said. So, control then at least you may stop or not stop smoking. I cannot force you to stop smoking, but at least I can give you a little bit of gyan. So there's small things that can can help. So maybe once you're around 40, then just go for a checkup once, and then I think it's basically all about a healthy lifestyle, regular exercise, diet. All of us indulge. Once in a while, we all indulge. It's human nature. You want to indulge.
I want to indulge right now. I'm on a diet. कस्तो हुँदो रहेछ भने in your 20s you really don't care रहेछ के at least म हुर्किँदाखेरि चाहिँ हैन अहिले त 20s कोले पनि एकदमै केयर गर्छ हैन 20s मा त्यति साह्रो केयर नगरे पनि अब 30s मा आएर चाहिँ अलिकति गरौँ न भन्ने हुन्छ जस्तो लाग्यो कि मलाई that's why I'm focused more on my 30s हैन तर हाम्रो नेपालको भूगोल हेर्दाखेरि हजुरले भने जस्तै हुन्छ नि 20 जना मैले यो अघिनको कन्भर्सेसन लिँदाखेरि 20 जना सर्जन्स काठमाडौँमा हुनुहुन्छ भनौँ न हैन 5 जना काठमाडौँ बाहिर हुनुहुन्छ हैन प्रदेशहरुमा हुनुहुन्छ होला हैन भनेपछि obviously हुन्छ नि हैन हामी कहाँ छौं संसारमा भनेर पनि त हेर्नु त पर्यो नि त हैन we're in a place where we need more doctors. For me personally, we need more hospitals.
I think more trained people.
Yeah.
Yeah, true. Yes.
And thank you for making sure that we are gonna have more in the coming years. Education system, sir?
So there are training programs. I more or less all the big specialty को training Nepal में गर्न सकिन्छ. Even for cardiac surgery, there are programs that give you the opportunity to become a heart surgeon or a. हामी चाहिँ कस्तो भने heart भनेर चाहिँ training कस्तो हुन्छ भने heart, lungs and blood vessels.
Okay.
So all three. त्यसको चाहिँ एउटा specialized program हुन्छ. So that program is available. So you can train to become a heart surgeon, and then maybe if you want to, then you can go out and do extra training.
Yeah.
In a good place outside, and then you see how it functions in the more, let's say, more developed countries.
Yeah.
And then you understand where the difference is.
Yeah. There's a very fantastic heart surgery that I'd like to go ahead and show you. It was done by X. Try to find this. We have to do this. We are a non-smart podcast sometimes. Try to find the South Indian movie where that heart surgery was done.
I saw that. Yeah. That's a famous one. We can't do that. We aren't that trained to do such things. Yeah.
Oh, there you go. Is this the one that we were looking at that day?
Yeah.
When one of my team guys sent this to me. We have to show you this one.
Yeah, I've seen this. This is very much in social media.
You've seen this?
Yeah.
And skip to the best part. Skip to the best part when the heart starts flying.
And then
there you go. He's grabbing the heart. oh yeah. There you go. This happens right away.
I'm not trained for this.
You're not trained for this. Oh my God, this is like the funniest thing I've ever seen in my life. Again, what should people be focused on? Like, what's your suggestion to the general public?
Basic awareness of your heart health. We're speaking about mainly because I'm in this profession. So heart health. So basically, there are certain things, like I said, which you cannot control. Your age, your genetics. But then at least you're aware that genetically, like this has been going on in my family. I would advise maybe around 40 years age मा चाहिँ एकचोटि चेकअप चाहिँ गराउनु हैन किनभने कस्तो छ भने our statistics say almost 40% above 50 are hypertensive, high blood pressure छ नेपाल हैन almost 5 to 10%. In fact, there was a very interesting medical paper that was taken in Gangala among patients who had Hridaya Ghat and came to Gangala, and they looked at the data, and like almost I think if I remember correctly, 80% had high cholesterol, which they were not aware of. Okay, 20% had high blood pressure, they were not aware of, and 10% had diabetes, which they were not well aware. I mean, what that tells you is it's not the people having heart attack. There's like that unawareness hunter. And if it costs money, what you raised, when you're young, you have this sense. I'm sure I also had it, that immortality. But then, if it stays in your 20s and 30s, maybe it's good. But when that immortality starts going into your 40s and 50s and 60s, then you're looking for trouble.
Yeah. Your documentary हेरेको थिएँ कि जुन डकुमेन्ट्रीमा चाहिँ हैन मलाई यो जिन्दगीमा एकचोटि गर्नु मन छ तर अहिलेसम्म मैले आँट गरेको छैन हैन. I love meat. I love my meat. I love my chicken हैन. So I haven't turned vegetarian yet हैन. But the blood changes when you go vegetarian. There was a documentary on Netflix where they definitely took samples of like people who went stopped meat and definitely moved on to its more vegetarian diet. And you, what was it? What the food you saying? I don't know which one I was watching. Blood actually changes, and it's better for your heart, if you turn. Like towards non-meaty food. Would you know anything about this?
I haven't seen that program, but what I would say is, I mean, once in a while, red meat is okay. Yeah. Lean meat is fine. I mean, even in the thing, like the dairy products in high volume, the ghee, the cheese, the butter, त्यो पनि अलिकति limit गर्नुपर्छ. So it's not only vegetarian. It's more of a paneer, high volume, right? So it's, I think, more of getting your own balance. It doesn't mean, what I'm trying to say is, it doesn't mean that now you have to become a vegetarian if you want to not have heart disease.
Yeah.
You can still be omnivorous and still work it out.
Yeah.
It's just basically being aware, being a little bit more disciplined. And I think what is important is regular exercise.
Yeah.
I think that's what's important. I think the best message for this would be regular exercise. That saves you a lot of trouble later on.
Yeah.
Now, I think the awareness has increased tremendously in the last 10 to 20 years. But just being aware of that.
Out of 100%, होइन हामीले मुटुको केही समस्या भयो भने होइन संसारको कुरा गरौँ न पहिला होइन कति प्रतिशत चाहिँ हामीले त्यो समस्या समाधान गर्न सक्छौँ जस्तो लाग्छ संसारको कुरा गरौँ न पहिला अनि हाम्रो देशको कुरा गरौँ न
Wow, that's a big... So, in the sense...
Give or take. Like, I read it somewhere, and obviously, fact check me on this. 99.9%, anything with heart, we can solve it in the world. You know, the science and technology and medicine has moved so ahead that we can solve almost anything related to heart.
Not really.
Okay.
Not really. So basically, if that was the thing, then, like my mom heart surgery garcho. Hamro ma ta risk cha ni ta. First thing, I would remove that.
Yeah.
I would, I wouldn't lose so much hair now if my surgeries didn't have a risk.
Yeah.
I mean, if my surgeries were without risk, I would have much more hair.
Wow.
So, so these things, so it's not totally true. But what is true is there's a lot of things which can be prevented. Okay. And the burden of heart disease in our region is expanding. And we need to be aware.
Wow, you bought something that's so okay. How much stress do you go through when you're working, when you're on the table?
No, it is a stressful job. Yeah, it is. I mean, so
a surgeon is like the most stressful, I believe, in the planet.
So heart surgery, coach, I think it's the drawback why people, a lot of even doctors don't want to do it is very long hours, and then the other one is the stress associated with it.
हामीले तस्बिर देखाएको छौँ कि 12 घण्टा 14 घण्टा होइन I believe more than that is.
Yeah, sometimes 14, 15 hours it goes.
You've done a 14-hour surgery.
Yeah.
14 hours.
Yeah, it does go. Over a duration of, it does go.
What happens in those 14 hours? Like if you had to break it down?
So what happens is the critical part, so what we say is the critical surgical part is much shorter. But like you asked earlier, so open heart, what is open heart surgery? So the critical part would be fixing let's say the valve problem, sir. मैले valve replace गरेँ. That is the critical part. So let's say when we replace a valve, it takes around 3 hours, the whole surgery. Okay. So that critical part is around maybe half an hour to 40 minutes. But then, like you have to go through the breastbone. You have to set up the hook into that machine, that heart lung machine. You have to do the procedure. Then after you finish, you have to revive the heart, hook them off, all that. And then we close the chest. So that would be 3 hours. The critical part would be much less.
Yeah. I can't even imagine. I'd seen this somewhere, and I have to ask you this. After everything is done, I saw somebody hitting the heart. Is that what is that?
Hitting the heart.
Yeah.
To what? Revive it?
Yeah, revive it or something like that. I'd seen it somewhere. Is that true?
Revive भन्दा पनि अब कस्तो हुन्छ भने कहिलेकाहीँ the मुटुको चाल चाहिँ when we revive it, it doesn't come normal. So you can shock the heart. It's more than hitting the heart. It's like you shock the heart. Where did you see this actually?
I don't know. I saw it somewhere.
So it's basically there's these paddles. It's like त्यो cardiac arrest भयो. त्यस्तै त्यो मुटुमा डाइरेक्टली हान्न मिल्छ.
Oh, wow. Above my pay grade. 14 घण्टा मान्छेलाई कतिजनाले त्यो रियलाइज heart surgery is the
not all surgeries
heart surgery is the longest in general. What would be the longest surgery?
I mean, I think there are a lot of surgeries where people have had to do it in stages. I know there are some neurosurgeries where the head and brain is stuck. You have to do it in phases. So maybe there are 3 teams involved, but it goes longer than that. I'm not sure. Maybe, I don't know, someone can look up 18, 20 hours, maybe even more than that. The entire
Find
session.
out what's the longest surgery in the planet. The longest one. When the babies are like together.
Yeah.
I think those ones are more. To keep
yeah.
on someone hasn't, but when they're like two babies head are together, I believe.
So
I'm sure.
That's not cardiac, but then I think those are also long. So I think every profession has a long surgery.
Yeah.
Ours, some of them because sometimes like when you replace this whole thing, you replace the whole aorta. That's a very long surgery. That's the longest one.
Hold on, what is that?
You're
talking in doctor terms now.
You're going to become a doctor in another 1 hour.
I want everybody to hear this out. The longest operation ever. 2001, less than more than what? 4 din?
But that's a Nepali ni, Ganga Jamuna Shrestha.
Oh, okay, hold on.
I didn't know that.
I didn't know that either. X, hold on, zoom out, padum to you. Okay, the longest operation ever. The longest surgery on record occurred in 2001 and lasted more than 4 straight days. 103 hours to be exact. A team of 20 doctors at Singapore General Hospital worked in shifts to separate Ganga and Jamuna Shrestha. 11-month-old twins conjoined at the head. Whoa, यो कहिलेको कुरा रहेछ भन्दाखेरि 2001 को. Wow, हेर त गंगा जमुनाको के रहेछ अहिले हेर त. I'm sure that they're like grown up now. हैन गंगा जमुना हेर त. I'm sure they're like grown up. थाहा छैन मलाई यो कुरा चाहिँ. What is like the trickiest one that you've done so far, if you can talk about it?
Yeah, so we get a lot of what I would say is dissections. So is dissection भनेको चाहिँ मुटुबाट निस्केको मूल रगत नली हुन्छ. That tears up, okay? So you have to and then it affects the blood supply to the brain and then the rest of your organs. So you have to replace and then do it in the circulatory arrest. It's a very high risk surgery. And actually recently I did a gentleman, he was from UK, he had come trekking and then had this in Nepal. And then we did the surgery and he's been back, I think 2-3 weeks ago.
Okay.
So yeah, these ones are it's high risk and invariably it's in the middle of the night. So you start maybe at 12 or 1 and then you finish like 6-7 o'clock in the morning if you're lucky. And then maybe even longer. And then, so yeah, we do all, we are the night owls.
Why do you do it at the night?
No, because invariably, it's an emergency, everything sets up. We do it anytime, but most of this happens at, unfortunately, I don't know why. I think patients land up there, or whatever, multi-factors, but invariably it's at the middle of the night.
Yeah. I remember this case. I know you were saying, obviously, my guest told me this, Manoj Kumar Kesiko kura garera, and he's going to be completely okay if I talk about this. I know. Uहाँले चाहिँ completely he played a gig. हैन, he was playing at Purple Haze. कतैतिर दुखिरहेको थियो कि छाती कतै न कतै हुन्छ नि हैन, छाती दुख्या हो कि पेटतिर दुख्या हो कि कतै न कतै दुखिरहेको थियो कि while he was playing. हुन्छ नि, he was playing the guitar and it was hurting him somewhere or the other. अब obviously हामीलाई पेट दुख्यो भने हामीले के भन्न चाहन्छौँ, हामीले खाएको मिलेन भन्छौँ होला, अदरवाइज हुन्छ नि, some of us have acid reflux हुन्छ नि हैन, ग्यास्ट्रिक हुन्छ, के भयो होला भनेर. It took him 2-3 hours अनि त्यसपछि एकदमै excruciating pain भएपछि बल्ल okay ल हस्पिटल जाउँ, अति नै गाह्रो भयो भनेपछि he went to the hospital and obviously he found out that हुन्छ नि, like something was not right. हैन, what is that? What exactly is that pain?
So what I presume is he was having, हामीहरूले medically भन्दाखेरि चाहिँ angina भन्छौँ कि, भनेको चाहिँ त्यो there is some degree of कस्तो हुन्छ भने heart attack basic layman term भनेको चाहिँ मुटुमा रक्त सञ्चार पुगेन. So the blood supply to the heart was inadequate and then the heart muscle, to some extent, a part of the heart muscles died. Okay. So that is, let's say, the full-blown heart attack. Now your angina भनेको चाहिँ कस्तो भने ब्लड रक्त सञ्चार पुगेको छैन तर नपुगेको सङ्केत हो के त्यो भनेको. I'm doing some activity तर there's some blockage that's not allowing full blood flow to the heart. So that because of that I'm troubled. The heart muscle in some certain areas troubled. So that's the pain. Now usually you'll have like a a constricting sensation. Some will say heaviness in the middle of the chest. And sometimes it goes to the arms, neck. One interesting thing is if you especially, I don't know, I see that a lot, especially people who come from the village. They say, mutu dukhyo, and they point here.
Tala.
Yeah. So, sometimes heart attack can mimic even a pain here. And there's a gastric punch. If you talk to the village people, they'll say, mutu dukhyo. I'm sure it must have come out because like some people had pain, yeah, and then they went to the hospital and realized that, oh, I actually had something of a heart attack. So village people say, if you talk to people, some even maybe the elderly in Kathmandu and other cities, mutu dukhyo bhन्छ कहाँ भन्यो नि यहाँ
Tala. Eta tala.
Yeah. So actually the heart is here. You actually have the constriction here. So I think that's what he was having. So maybe, I'm not sure exactly, maybe it wasn't a full blown heart attack, but some degree of, the heart muscle was craving that, like I'm not getting adequate blood supply.
Yeah. I'm definitely going to ask you this, follow up on this. कतिजनालाई थाहा नै हुँदैन होला हैन कि थाहा नभएर पनि त्यो automatically pass हुन सक्छ if you have like a
usually हुँदैन हामीहरूले अब मेडिकली भन्दाखेरि चाहिँ डायबिटिक बिरामीहरूमा चाहिँ कहिलेकाहीँ पेन नहुन सक्छ सो बेसिकली कस्तो भने मुटुको समस्या भएको सङ्केत या what you can suspect one is obviously chest pain अर्को भनेको सास फुल्ने स्पेशली केही एक्टिभिटी गर्दाखेरि like I climb up flight of stairs I'm short of breath I'm walking with my friends I'm lagging behind why because मलाई सास फेर्न गाह्रो भइरहेछ
त्यो लङ्स होइन त्यसको मतलब
लङ्स मात्र होइन मुटुमा पनि हुन सक्छ हैन त्यसपछि कहिलेकाहीँ मुटुको चाल त्यो एकदम पाल्पिटेसन भयो मुटु चाल एकदम फास्ट चल्यो हैन अथवा रिङ्गटा लाग्यो म बेहोस भएँ हैन अब अरूहरू पनि छ हैन अब but these are basically the main things so if you have like one of these then just get yourself checked up हैन I think it's normal we all are in a phase of denial
obviously
yeah so we feel like मलाई त के हुँदैन उलाई हुन सक्छ तर मलाई चाहिँ हुँदैन and I think that's where we get into trouble
yeah
so if you have one of these then if you just go seek advice medical advice
yeah don't Google don't Google we have Dr. Bijoy here, we have the entire team. Don't Google. Go, get checked up and then...
No, Google's helpful. Yeah, we got a lot of information.
Yeah, it definitely is helpful. I know when there are certain things that definitely is so bad. I know, and थाहा हुँदैन जब आफ्नै फ्यामिलीमा पर्न थाल्छ अनि त्यसपछि थाहा हुँदै जाँदैछ कि obviously cancer is like I've seen it within my circle of far-fetched family members. That is like by far for me personally that is like the worst thing and I do not wish any disease to anybody, especially cancer. त्यो चाहिँ त्यो I hope मेरो जीवनकालमा हाम्रो जीवनकालमा त्यसको चाहिँ केही न केही त्यो के भन्छ त्यसलाई उपचार
निस्कोस् hopefully
हैन that is something that scares the shit out of me हुन्छ नि त्यो चाहिँ एउटा चाहिँ त्यो I don't know how to say it, but obviously, as human beings, we'll always eat all the wrong things. We'll always have problems. Exercise, I believe, is the utmost thing that came out of this, and diet, I believe. I know that I emphasized right in the beginning as well, and right at the end also. I'd definitely like to end this with like emphasizing on proper food is very, very important. I'll ask you this. 1000जना कम्पनीहरूले 1000वटा ब्रान्डहरूले 1000 थोक बेचिरहेको हुन्छ कि हैन यो खाऊ हैन यो हाल तिम्रो खानामा अथवा यो खाऊ अनि तिमीलाई चाहिँ के रे कोलेस्ट्रोल हुँदैन तिम्रो के रे मुटु हुन्छ हैन मुटुको फोटै हालेर बेच्छन् 1000 जनाले हैन Do you think that actually works all the time? How much do you believe in that?
You mean food products?
Food products.
I don't. Too much.
Okay.
Some may be right.
Okay.
But I think what happens is with me, because I'm from the medical community, I can to some extent decipher.
Yeah.
I know. You get a lot of people who will say, "Mata, patuna, yo brand ko tel linsu." So I should not be having any issues. But I have high blood pressure, I have diabetes, but I'm just using this brand of oil which has been marketed to miraculously prevent heart disease. That doesn't mean you're gonna. That's why it's basically, I think the whole idea of this is bring awareness.
Mm.
It's not one thing. Just because you've taken this brand of oil, the chances of you having a heart problem is nil, as opposed to someone else who's using another brand or something else.
Yeah.
It's an entire lifestyle and risk factors that we are talking about.
See, एक थोक मात्र change गरेर एक थोक मात्र गरेर त्यो obviously I know exactly. That's why I wanted somebody to hear this as well within my family. Before we let you go, Rock, I wanted to ask you another specific thing. अस्ति भर्खर एउटा, of course, from my dumb brain, I don't understand the combination of the medicines that the government advised not to use. Medicine को हिसाबले चाहिँ हैन हामी कहाँ छौँ? Medicine को हिसाबले to prescribe medicine को हिसाबले चाहिँ हामी कहाँ छौँ? Do we have all the medicines that we need?
So, I think this is a very important question. The newer ones aren't there. There's a government process which is a little bit more tedious. Okay, the newer ones haven't come in, so we've dialogued with them, just made that aware. It doesn't mean that we cannot treat someone and don't want to send out a false thing that there's nothing there. And the newer ones that are coming out, that has to come in to the country faster, let's say, including the newer devices, newer things, newer technology, that because science is progressing. Medical science is it's amazing. And things can change. Today, what I'm practicing may become obsolete in even 5 years down the line. So for us to have everything available is important. So I think the newer things need to come in. The system has to improve. That's a whole different chapter. So so I think that these things need to come in. It eases the physician's life.
It will ease your... Okay, so let's talk a little bit about this. एउटा specific... I'll jump into something else. एउटा specific cancer को दबाई यो देशमा पाउँदैन भनौँ न XYZ हैन पाउँदैन यो देशमा बाहिरबाट ल्याउनुपर्छ बाहिरबाट ल्याउनको लागि त्यो व्यक्तिले ब्ल्याकमा किन्नु पर्ला त्यो व्यक्तिले गएर 1000 थोक गर्नु पर्ला त्यो दबाई ल्याउनको लागि हैन खानु त त्यही दबाई पर्यो because that दबाई might be like game changer हैन life changer हुन्छ नि मेबी त्यो दबाई खायो भने चाहिँ एक वर्षबाट के अरे लाइफ स्प्यान 5 वर्षमा चाहिँ बढ्ने चान्सेस छ लास्ट मोमेन्टमा गएर त मान्छेले चान्सै त हेर्ने होला नि हैन र लाइक इभन इफ यु हेभ अ लिटल बिट अफ एक्स्ट्रा बुस्ट हुन्छ नि इफ यु हेभ द मनी इफ यु हेभ द रिसोर्सेस मान्छेले त खोज्छ होला हैन अब हाम्रोमा चाहिँ when it comes to hearts where do we actually stand in medicine?
So the basic medicines are there, but as science progresses, as newer things come out, those things need to come in a little bit more faster, I would say. Let's put it that way.
Okay.
Being gentle and polite. So I think that process needs to be a little bit more faster.
Don't worry, I'll add the craziness here. मलाई अस्ति म छक्क परेँ कि मैले अस्ति पनि I shared this when Dr. Adhikari was here हैन म विदेशमा हुँदाखेरि मैले यसो हेरेँ कि त्यो डब्बामा हैन त्यो डब्बामा हेर्दाखेरि मैले के देखेँ भन्दाखेरि I was in a western country and I saw that the medicine was made in India.
Possible.
हैन अनि म त छक्क परेँ एकछिन सो त्यहाँ बेच्ने medicine is made in India which is right next door to us where we have treaties of almost everything for the past 50 years हैन and apparently when I just did a simple Google सबै medicine त भारतमा बन्द रहेछ त majority of the medicines if I'm not mistaken are made there.
No. So there are a few big companies of Indian pharmaceutical companies that have a presence here. They have medication here. They're supplying for quite some time. It's great. There's a big pharmaceutical industry in Nepal itself. So a lot of medicines are produced here by Nepalese companies. So there's lots.
And we can have it here itself.
Yeah. I think they're producing. I don't know the nitty-gritty on how that functions, but there are a lot of companies that are producing medicines in Nepal.
Okay, so when it comes to hearts, obviously we can import medicines or we can produce it within Nepal. Patented medicines. Might not be the right... 5.92% is भारतको चाहिँ.
I don't know what I won't be surprised if they are exporting as well.
Yeah.
The pharmaceutical companies in Nepal, I'm not the right person to answer that.
Yeah, obviously. Yeah.
But I think what I'm trying to say is like the newer medicines that become available
in the world.
We need to start pushing these things also faster in Nepal. I think there's a little bit of a process and all that stuff. But then if that comes in faster, then you're keeping in time with what's happening around the world.
Yeah.
So but there are a lot of companies here. I think there's more than 25 companies here, pharmaceutical companies.
Yeah, well, remind me actually, we need to invite somebody from pharma to to figure this out. किनभने म चाहिँ होइन मैले जब सुने कि हुन्छ नि होइन कोभिडकै बेलामा कुरा गरौँ न होइन देयर वाज स्पेसिफिक मेडिसिन जुन मेडिसिन वाज अ बिग डिल होइन त्यो मेडिसिनकै अब त्यो मेडिसिन मान्छेले कताबाट ल्याउन खोजे बोर्डरबाट ल्याउन खोजे प्लेनबाट ल्याउन खोजे 1000 थोक भयो त्यसको लागि हाहाकार भयो एक समयमा कोभिडको टाइममा होइन अब वी डोन्ट नो इफ द्याट मेडिसिन वर्क्स or not, but people bought that medicine in crazy prices. And I was like, त्यो समय पनि क्रेजी समय थियो.
Yeah, exactly. That's what I was going to tell you.
होइन त्यो समय पनि क्रेजी समय थियो होइन. But again, there's always new medicine that might have chances of extending your lifespan. And if you have the money, if you have the access, you definitely want to try it.
I think it comes down to what we talked in general, the whole thing, availability of device. I think it's basically applying a system in a whole scale to improve, what would you call it? Health equity? Maybe that's the right term for it.
Yeah.
In the country. So you're not talking about one individual or one group of people who can afford or not, but a health equity so that, everyone is provided a standard of care. And a quality of care. Right?
Sabaiको biggest fear के रहेछ थाहा छ डाक्टर साहब मेरो biggest fear भन्छु. I'll tell you what my biggest fear is. होइन my biggest fear is not being able to provide. होइन not being able to provide healthcare to my family members. होइन त्यो healthcareमा त्यो एउटा X factor आउँछ कि त्यो zero कहिले पनि सकिँदैन कि जति पनि हुन सक्छ त्यो zero. It can be infinite amount of zeros, infinite amount of zeros that you can put in that checkbook. त्यो सबैको डर हो जस्तो लाग्छ कि मलाई.
होइन त्यसै कारण त भनेको that we talked about, we need to have some form of insurance system in the country. Someone has to look into this. I mean, I'm sure you must have had more physicians talk about this also. I mean, do I have 100% solution on how it should work? No. But we need to look into this because, and it's known globally also, insurance nabhaikana ta, it's what? You take money from because everyone doesn't need treatment. So let's say you take from 30 million, but maybe you're just providing healthcare to
half a million.
Half a million. But then that half a million, and when I need it, when I become that half a million, I get, like what you said, you don't have to worry about, I think because that, frankly speaking, that is a major stress for any person.
That's a stress for me. I'm going to be honest and tell you.
No, it's for anyone. You think about it. If someone comes in, let's say, as a physician, if someone comes in and then says, I can't afford the treatment, it's very difficult. I mean, fortunately enough, cardiac ma chai, there are subsidies, especially in government hospitals. Private ma ta ali different bhayo. Gangalal Manmohan Hospital teaching ko. त्यहाँ चाहिँ subsidized चाहिँ छ. 15 वर्ष मुनि free छ. 75 वर्ष माथि free छ. Rheumatic heart disease goes treatment for free. So we've made progress. It's not all doom and gloom, but there's so much we can still do.
जोसँग छ उसँग छ हैन उले जहाँ पनि जान सक्छ संसार होल वर्ल्ड इज योर oyster हैन जोसँग छैन उसको लागि गाह्रो त्यही त हो नि
हैन त्यो त कस्तो भने त्यसै कारण त I think it's time we looked into. I think government tried to start that insurance, but it was such a like it's 50,000 now. So I think come up to 1 lakh. And then I think there's too small a population that is into it. So I think we need to look into this more in a wider scale nationally.
While you're still talking about this, I'll take 5 more minutes of your time. Google गर त सार्क नेशन्समा हैन इन्स्योरेन्समा चाहिँ फोरफ्रन्टमा चाहिँ कुन चाहिँ देश रहेछ मलाई किन मलाई भुटान लागिरहेछ हैन just double check that when it comes to health insurance around the world I believe the UK or one of the Scandinavian countries has the best healthcare if I'm not mistaken.
US also I don't think it's a very good system yet.
Those guys are struggling जस्तो लाग्छ मलाई चाहिँ डबल चेक गर्दा सार्कमा मात्र हेरौँ न अब त्यो टाढा जानै परेन नि सार्कमा के छ सार्कको एकपल्ट हेरेर त के रहेछ सिचुएसन किनभने obviously त्यो सबसे ठुलो stress हो हजुरले नै अघि नै भन्नु हो नि if something happens, something goes wrong, just for you to buy that के भन्छ त्यसलाई that
Device,
equipment,
yeah.
that device 60-70 lakh rupees, you have to think 10 times.
Yeah.
And you are the best among 25 in this country.
No. Let's be a little more humble.
So again, it's a again, not everything is doom. We try to stay as optimistic as I can. तर time मा चाहिँ कस्तो रहेछ भने धेरैजनालाई झकझकाउनु पर्ने रहेछ हैन. And my platform is definitely not the place to do that, but apparently sometimes it's it's a place to do that. Sometimes.
You have like 10% of the population.
1%.
I think we've made it 5 now, probably.
Thanks for that. Yeah, the X, if you can find something, and then we'll definitely, I know Doc needs to go. Azza, do you have anything?
No, I think I'm good.
I say touch wood then on that. 14 hours, that's a long time. I don't know how you do it.
Yeah, it's strained.
How many surgeries have you done if you...
Maybe around 5,000-6,000 open hearts.
6,000?
Yeah, because I know I don't look that old.
6,000, that's a big number.
We've done quite a bit.
That's a big number. What do you wish people to do? If you had to, एक थोक भन्नु पर्यो भने हुन्छ नि हैन कि यो चाहिँ नगर्दिनुस् न तपाईको मुटु चाहिँ हुन्छ नि अलिकति भए पनि हुन्छ नि हैन ठीक हुन्छ भनेर एक थोक नगर्दिनुस् भने what would you pick if you had to pick one thing?
One thing I think it would be exercise, regular exercise.
त्यो चाहिँ गर्दिनुस् के नगर्दिनुस्?
के नगर्दिनुस् भन्नु त एकदम मुस्किलले भन्नु पर्ला तर at least एउटा regular exercise गर्यो भने I think it helps.
Stop smoking, man. I promote that, so I'll definitely push that. Did you find anything? You guys are trying your level best. All right, keep searching it, and next time when Doc Sab is here, we're going to definitely go ahead and talk about that. Thank you so much for your time.
Yeah, sure.
Thank you so much for your time, and again, you'll be coming back again. This is the first time, but definitely not the last time. I'd love to have you over again.
Can I say something?
Obviously,
just on a personal note? You said, what regret do I have about this entire thing?
Yeah.
I think one regret is I put my wife and my kids under a lot of stress. I leave in the middle of the night.
Yeah.
You know, like I am out. My wife basically, I mean, thank you to her. She's like, she handles the kids. I'm barely around.
Yeah.
And I think I wish I could be more with them.
Yeah.
Like recently I missed my kids play, but this is what it is.
Phone आउने बित्तिकै you have to go, eh?
कहिलेकाहीँ त yes.
As soon as the phone's on, hold on, we'll put up a picture of your wife and kids. I have.
Oh, do you?
Yeah, we will. X, check your WhatsApp. I definitely like to. I want to go and show this. How old are the kids now?
9 and 7.
9 and
7.
All right, let's go ahead and put this. You know, down the road, they would love to go ahead and once they grow up, they'd love to go ahead and see that dad went to Sanjay Dai's podcast. X, check your
It's Sanjay uncle, by the way.
Oh man, damn. Oh, uncle. Yeah, that is so true. I'm 35 now. I'm an uncle by now. X, put this up, eh? Yeah, I'm sure it's gonna be it's very straining for the entire family as well.
Yeah, but I guess I love my profession. I wouldn't do anything else. So.
Again, obviously, this is not I don't do any sponsored podcast, but in general, Mediciti, I just want to touch bases on this. I know. Oh, there you go. Beautiful. What are their names?
Arav and Ashna.
Beautiful. Nice.
Yeah. Thank you.
Thanks, X. Right at the end, Mediciti I've used Mediciti services, has almost everything, and definitely if people want to get in touch with with you, they can definitely go through Mediciti and definitely get in touch with you if anything happens, right? Yeah. We'll try to go ahead and put a little bit of information on that as well, if you're okay with that.
Thank you so much. No, I think that's fine. I think the hospital's going to love that.
Sure, why not? Obviously, like I said, it's not sponsored. We'll definitely do it. I've used their services, and I've always liked that. Thank you so much for your time. Thank you so much for having me. And again, I'll see you soon.
Yeah.
All right, everybody.
If you love what we are doing, make sure that you subscribe and turn on notifications. This program is brought to you by Vyas Studios.